It is Tuesday, June 2nd, and welcome to the COVID-19 Task Force Daily Update. I am Joe Delarone. We are into day 2 of the reopening of Kahnawake business. Joining us on the program today will be Dr. Annick Gauthier, but we'd like to start off with a member of the task force. He's one of the 2 council chiefs who is sitting on the task force. So let us welcome Ratsénhaienhs Frankie McComber.
Thank you, Joe. Good afternoon, everyone. We're living through a very different and difficult time. We are going to get through this together, though. We all have a choice, and we all need to still practice social distancing, and we need to wash our hands, at least every hour. We all have needs. Some of us need to work, some of us need to stay home, and that's okay. Some people need to open their businesses, and some people need to keep their businesses closed. That's also okay. Some people need to work more, and some people need to work less. And I think it's important that we all know that it's okay to do this, and we all have to be able to depend on each other. The most important thing is that we work through together and we get through this together. And thank you all.
Thank you very much, Frank. Yesterday, and actually the last couple of days, we've been mentioning this pamphlet that has been out in the mail. I haven't gotten mine yet because I haven't been to the post. However, it makes for some good reading, and it's COVID-19, how can I protect myself, my family, and my community? To give us more of an insight on what is in here and why you should read it is our good friend, Dr. Annick Gauthier.
Kahnawà. So, fear. I don't know if you recall, I have some loyal viewers, including a lot of my patients, including one that I saw today, and they watch me every time. And if you recall back to my first Facebook Live was on March 27th. This will be my 10th today. Fear is in all of us. It's a normal human reaction. We can't tell people not to be fearful. But what I said then is just as accurate as what I'm going to say now, is that the answer to fear is accurate information. So there are 3 active cases in the community at the moment. It's really important for people to understand and really note that these occurred before the opening of Kahnawake. Actually, they occurred before the opening of Montreal. These people are excellent community members, and they tried to apply all of the measures, but social distancing is a hard one to apply. Everyone loves their family and wants to be close to them. And that's why physical distancing, along with hand hygiene, are the key to this. No one's blaming anyone. We know that this virus is very strong. One of the reasons why it's so strong is that you don't have to have a lot of symptoms and you can still pass it on. There are other viruses, so if we look at Ebola or even the original SARS virus, they are much more deadly. And that means that actually the number of people infected is much smaller because those people can become sick very, very quickly. With SARS-CoV-2 or the disease called COVID-19, people don't get as sick and therefore can spread to each other. And that's why the main measures that we have to do, and I know I sound like a broken record, but is hand hygiene. Physical distancing, so being that, and then from me to the camera is 2 meters. Remember a couple weeks ago I showed you with a pole that's 2 meters. It's actually not just 6 feet, it's actually almost 6.5 feet. That's how far away we should be. And the idea behind that is so that when we cough, it falls to the ground before it gets to the person's nose or mouth to enter. So now I'd like to go through the pamphlet. It's a pamphlet that we worked on at KMHC. A number of people were involved with it, and now it's all in your mailboxes. So I encourage you to go and look at them. So the first page of the pamphlet shows how I can protect myself, my family, and my community. And it goes to the bottom is, although the risk of severe illness is different for everyone, anyone can get and spread COVID-19. But everyone has a role to play in slowing the spread and protecting themselves, their family, and the community. So if we go into the inside, we have some lovely pictures of some dear, I want to call them friends of mine, because I think they call me when I'm on the wards with them. And they're reminding us of a variety of things. So in the first panel, we talk about social distancing, so staying 2 meters apart. So we talk about this all the time. The second panel is about hand hygiene and how hand hygiene is crucial, that we need to wash our hands. And there's been studies that show if you wash your hands 5 to 10 times a day, you decrease the risk of SARS-CoV-2, influenza, all of these viruses. Washing our hands is mainstay. Respiratory hygiene, so that means coughing into the nook of your arm. My little niece, my littlest niece is just over 2, she calls it her cough pocket. So I want everyone to cough into their cough pocket. Hi, Poppy. Fourth is non-medical masks. And I have my favorite bears that I showed you a few weeks ago about how just like you want to be the bear, the creamy peanut butter bear, and have your mask over top of your nose and your mouth and your underwear on properly. And you want to not be like the crunchy bear that has the mask under their nose, only covering their mouth or only covering their neck. And then the corollary was having their underwear down by their ankles. This is a joke. Your underwear, you can wear or not underwear depending on your practices. But I want you to wear a mask if you can't be 2 meters apart. But ideally, you would do everything in your power to be 2 meters apart. The middle section is how everyone needs to protect each other. So we'd have a lovely picture of some of our elders at KMHC, and they're saying things like, stay home, always social distance, no visitors inside, call often. And we go into how to protect our elders and our vulnerable. We talk about elders a lot, but it's not just elders. It's people with poorly controlled chronic diseases. It's people who have other health concerns, people who are immunocompromised. So independent elders should stay home, inside or on their property, and always social distance 2 meters or 6 feet. And what we're talking about as elders is anyone over 60. I know in the first rounds we were talking about 70, but now we know that the most, unfortunately, fatality occurs when you're over 60 years old. Dependent elders, so elders that require someone else to live, if they're not at KMHC or Turtle Bay, they are protected and cared for. But if you have an elder in your entourage that needs other people to live, you have to make sure that that person, that family member is dedicated to them, or there's 2 people that are dedicated, and they don't go out, they don't go buy the groceries. You have another family member that goes in and buys the groceries. Same thing with your independent elders or independent vulnerable population. Call them, FaceTime them, go bring the food, bring it up to their front door, talk to them from their driveway. That's what we need to do. The last, on the back of the pamphlet, it goes through the last point, and I think it's really important that we need to create a culture that it's okay in a loving and respectful manner to correct people. Remind them to wash their hands. Remind them to wear their masks properly. Your community is very close to each other. You see your family more often. You live all within the same community. It's very beautiful. I treasure that, and I think that's a wonderful aspect of your community. But it also means that you need to make sure that you do everything to not bring the virus to your loved ones. And so that's really being loving and respectful when you give feedback to people, and then also receive it in a loving and respectful manner. The next point that I wanted to talk about was an ad that you might have seen in the newspapers and on Facebook last week about physical distancing in family gatherings. So now we actually can have up to 8 people from different families gather together. But again, everyone has to be 2 meters apart. So your family unit can be in one place. So this is, we have on the top is the 2 ways of safely gathering. You have 2 families. We have the blue family, family A, and the burgundy family B. and they are, family A is separated to family B by 2 meters or over 6 feet. And the same thing is you can have 8 friends that are together, but they're all separated by 6 feet. And so the families are separated. So yes, it's being outside. Yes, that means on some hot days that's great. On some colder days or rainy days, maybe you don't want to sit outside or you have to bring your umbrellas. But that's the point. Another question that I get a lot is about pools and swimming. So I just want to sort of explain, and the Quebec Public Health Research Arm actually did a report on this, 18 pages. I can send it to anyone who wants to read it. But basically, the water is not the issue. So COVID doesn't live in the water. The issue is actually the proximity of people to each other, and people touching handles and using all the same things, and that's the problem with swimming. So again, for your swimming pools, for going swimming in bodies of water over the summer, it really is about making sure that you're still 2 meters or 6 feet apart from others. I know it's hard to balance the idea that businesses are reopening because some people do need to work, some people need to bring in income. We know the effects of the isolation, the effects on money, monetary, the effects on mental health. Those are all incredibly important things. We also know that we cannot stay closed forever. If you ask me a question, when is the good time to open? I would say there really isn't a good time to open. But on the other side, it's when is it a good time to not open? The answer is we also don't have an answer for that either. It's a balance. And we need to open and gradually expose ourselves while doing all the measures of hand hygiene, physical distancing, wearing a mask if you can't do those things, in order for us to prevent the spread to a high degree that we're not able to control it. And when people have symptoms, we need to be able to clamp down on them, go, okay, they're self-isolating, we've tested them, we know if they're COVID positive or negative. We've done so many things in the community to make sure the businesses are safe, but as customers and as community members, we also have rights and responsibilities. It's difficult to control the behavior of others. The only person you can control the behavior of is yourself. So your rights and responsibilities, you have to wash your hands. So hand hygiene is number 1. Number 2 is if you're sick, if you feel unwell, you don't go shopping at Walmart or any of the local merchants. You stay home, you self-isolate, you call to be COVID tested. You have to physical distance 2 meters, respecting the markings on the grounds. If there isn't markings on the grounds at the establishment that you're going to, you pretend there are markings and you pretend you know what 2 meters is like, and you go, a queen-size bed, a king-size bed, sorry. You pretend that's between you and the person in front of you, and you make sure that the person behind you is also 2 meters. If you can't social distance, you wear a mask. You do this properly. It goes through in the guide, the pamphlet of how to do that. Gloves. I'm not a big fan of gloves. I've said it before, no frickin' gloves. Because no gloves unless you're putting your hands in a body cavity. And unless you're working in the butcher or in an operating room, that's generally not where you have to put your hands. Healthcare workers we know that we wash our hands less if we're wearing gloves. So that's why we only wear gloves for the procedure that we need to and then remove them. They're a one-use thing. They're not going from item to item. And then the 5th thing is that about culture. It's speaking out in a respectful manner. If you see others in the establishment or employees not following the above, you say this in a loving, respectful manner. And if no one listens, it's your right and your responsibility to leave. We are in this for the long haul, but together we can get through this. We can protect all our elders, all our vulnerable population, and we can continue by loving and being caring and kind to one another. Thank you very much. Kahnawà.
Thank you very much, Dr. Gauthier. Just a couple of notes here before we leave. Dr. Gauthier mentioned the 8-person maximum in Kahnawake. If you're listening to K1037, they're running ads from Quebec, and in the Quebec guidelines say 10 people. So that may be causing some confusion among people in Kahnawake. So just make sure, again, the correct information, the Kahnawake guidelines are 8. You hear that right here on the COVID-19 Task Force Daily Update. All right, 8 people, not 10. The other thing is, just a note on today, this being the second day of Kahnawake being reopened, the traffic situation, we're happy to report, is nothing like it was yesterday, which was just a madhouse and caused a lot of concern. It was a lot more manageable today. There will be a press release going out a little later on today that just updates the situation and some of the policies, etc. So just be on the lookout for that. And that should do it for today's program. So we'd like to thank our Ratsénhaienhs Frankie McComber for taking a few moments to talk to you today and to talk to all of us, and of course to Dr. Gauthier for her excellent presentation. And we'd like to thank you for joining us. So until next time, take care of yourselves, stay clean, stay apart, and if you don't feel well, stay home, get yourself tested. So on behalf of everybody here, Nyaukoa Dano, Onigiwahi.